Thank you, Carla. Minister, since the arrival of COVID into our country, a clear and present danger has existed, not just to the lives of our elderly and vulnerable, but also to the social and economic cohesion of our state. COVID-19 is largely a killer of the elderly and those with underlying medical vulnerabilities. Thankfully, our knowledge of dealing with and treating this illness has advanced greatly over the past 6 months, and despite its dangers, COVID must not be allowed to sideline the many other significant healthcare areas that patients need support in, particularly in cancer, trauma, disability, mental health and chronic disease. Recent announcements by Government of increased funding for the winter plan and the overall healthcare sector include the addition of €600 million to fund more frontline staff, to develop additional ICU and HDU bed capacity, to provide additional hospital beds and to ramp up to 4.7 million additional home care support hours, which are greatly welcomed. The funding is to be welcomed, but along with these resources, health service managers, Minister, must seriously look at how they can reorganise and innovate to deliver increased efficiency and hospital throughput. In our acute care hospitals, the issues of COVID planning pathways must be reviewed with respect to daily case scheduling. We need innovative thinking in terms of expanding diagnostic services, particularly in scanning and scoping areas, to address the backlog of cancer patients waiting for access, care and treatment. We need increased radiology, diagnostic scoping and biopsies to address the significant wait times which are emerging in symptomatic and prostate cancer services. Medical needs extend to my own constituency of Waterford, as you know, Minister, where diagnostic angiogram lists are now extending up to 12 months again. We must consider the use, Minister, of the National Treatment Purchase Fund in both public and private hospital settings to support extending these service opportunities. Our first priority must continue to be to secure the health of our elderly, particularly those in residential accommodation. We need to ensure ongoing randomised testing of healthcare workers and strict visitor infection protocols, particularly over the winter months. Rapid diagnostic tests, although shunned by NEFIT to date, have shown a pathway to increasing random testing elsewhere in the world, and hopefully we'll see their use authorised here as soon as possible. The announcement of the additional 700 swabbers and contact tracers is welcome, given that it should allow redeployment of health staff back to their jobs where they are so badly needed. The focus in the winter plan on keeping people with physical health needs out of the hospital is welcome. However, the plan appears to have bypassed patients with ongoing mental health and disability issues, as no money has been provided to address their needs or how they can be cared for in the community. This is an area of Healthcare Minister that must receive additional priority and allocation of resources. Government has given us a winter healthcare plan, and although it is extensive in comparison to previous years, the healthcare needs of our nation have never been greater. We must continue to rely on the truly great legions of healthcare workers in our state who look after our citizens as well as they can. We must persevere in calling all in our community to continue adherence to all of the COVID rules that we have learned in recent months, so that despite intermittent cluster outbreaks and lockdowns as months elapse, we can repair our economy and health services and hopefully steer a path from this global pandemic. Thank you.
Thank you very much, Deputy Shanahan.